if you're not from quality, still you can be a better engineer. If you're an engineer, you can be a better engineer. If you're a doctor, you can be a better doctor. If you're a nurse, you can be a better nurse. If you're a logistics professional, you can be a better logistic professional, so that you can improve your own processes, improve your own products, improve your own services. And let us have another poll too. The third poll. So if you can just select your salary range. So a Lean Six Sigma Green Belt and Black Belt is able to increase your salary by minimum 15%, and it sometimes goes up to 25% and 50% also. It depends on how well you learn. When you join our Green Belt and Black Belt sessions, we take you through the projects. We do a project along with you. Today also I'll be doing a project, but you don't have to do a project along with me. But when you join my Green Belt and Black Belt program, then you also do a project along with me. So we give you the template, we give you all the guidance, so you get the real project experience as you learn. So we apply whatever tools and techniques we are going to learn in our Green Belt and Black Belt. We generally we apply these tools and techniques to our own project. Thank you. Thanks a lot. And are there any other polls my team can just put in case there are?
Nothing.
Okay, so a quick introduction about myself. Okay, before that, let me tell you the agenda. So here we'll be starting with an introduction of the company and myself. I'll introduce a little bit. I'll spend around 5 minutes so that you get the confidence that you are learning from the right person. Then after that, we'll be talking about Lean and Six Sigma benefits. Then I'll introduce you to the Lean and Six Sigma concept. And then after that, we'll talk about DMAIC, define, measure, analyze, improve and control, DMAIC. So whenever you are doing a project, see, what is Lean Six Sigma? Lean Six Sigma is a project improvement methodology. Now, how is it different from other methodology? The basic one important thing is we follow a project approach. So whatever we want to improve, we convert that improvement opportunity into a project. So suppose you want to reduce the cycle time. Cycle time is, let's say, 12 hours to complete a job. We would like to reduce this 12 hours to 6 hours in the next 6 months. That becomes a project. The basic definition of a project is it has a starting point and it has an end point. It doesn't exist after some time. The project, the flow is define, measure, analyze, improve, and control, and we are going to learn about it. Then as we learn, go through the DMAIC cycle, we will learn some tools and techniques, and I will also do a project along with you. Then, if time permits, I will talk about some applications of Lean and Six Sigma in industries. And if you are willing to spend half an hour more extra, I will also talk about some additional topics and some roadmap. How do you implement Lean and Six Sigma in an organization? So right now, let us start with the introduction of the organization, and let me welcome you formally.
Hi, welcome to Anexas. Anexas has been consulting and training the professionals in the organizations around the world since 2006, and we have trained more than 150,000 people and consulted for more than 500 organizations, which includes Fortune 100 organizations too. I'm Amitabh Saxena, and I have designed this program based on my 30 years of experience while working in various industries across many domains. The whole Anexas team once again joins me in welcoming you.
So a team of 25 people is behind this yellow belt training, and on behalf of all of them, I would like to welcome you. The organization has been existing since 2006, and we have been enabling individuals and organizations to achieve excellence, and we have trained lots and lots of people. Well, if I tell about myself, 1990 I graduated, and initially I joined a refinery, petroleum refinery. I used to work very hard. 12-hour shifts I used to work, but first 10 years, my salary was not much. And those days, the salaries were obviously a little lower than what you earn today, but it was too low. So I thought of increasing the salary, and I started looking for opportunities to increase my salary. One fine day, the organization announced that they want to send the top 10 performers of the organization for some training called black belt training. And these projects, once they complete these employees, once they complete the training, they have to do an improvement project. So I thought I was one of the top 10 performers in the company, but unfortunately the company did not think so, and I was not nominated. But good thing what I observed was that when these people came back after the training and when they did the project in the next 6 months, each and every project saved millions of dollars for the organizations. And every person contributed positively to the bottom line, means the profits of the organization. So every project saved a lot of money. It was a data analytical approach, and I was very impressed with this whole methodology. I thought next batch I would join, but next batch never happened because all the 10 black belts who got certified, they soon got another jobs, much better jobs. And then after that, company did not conduct the training. So then I thought I would get the training myself. I started searching and I invested some good money. And after that, after investing some good money, going to those days, very few places and for few companies, few organizations used to conduct the training. So I spent some good money. And as I said before you, I am a Lean Six Sigma Master Black Belt Data Scientist, PMP, CPHQ, 33 years of experience, consulted more than 200 organizations, including 15 Fortune 100 companies, and right from EDNOC, Aramco, SABIC, King Fahd Medical City, International Medical Center, King Saud University Medical Hospital, Dammam University Hospital, Nautel in Middle East. I'm talking about Saudi Arabia, then Miral, Warner Brothers, Ferrari World, DP World, Al Futam Group, and many organizations in UAE, Steel Authority of India, Bharat Petroleum, lots of banks in India, lots of logistics company, Transport Corporation of India, lots and lots of companies, Emirates Airlines, like five-star hotels, lots of hospitals. In Europe, National Healthcare Services. These are all our clients. So I've done lots of projects. I have guided lots of projects. And today I'm going to share some of my experiences. And you too can achieve all these things. That is why I'm telling you, because you'll be learning today not only from my experience, but also from what my students have achieved. Some photographs of my trainings, right, for the last 20, 25 years, I've been conducting a training program. So when I used to be young, this was England, this was done in London, lots of cities. I also take pride in telling that I was the first person to conduct a black belt training in whole of Middle East. And that was covered in the newspaper and TV channels also in the Middle East. And that was incidentally, that was a batch in a hospital in Riyadh. A lot of quality directors from various hospitals had attended that training. Then after that, immediately it was for a petrochemical company. Novartis and lots of European companies, Maersk in Denmark, lots and lots of training we have conducted in multiple organizations in different continents, and won lots of awards in various forums, appeared on TV shows.
Hi, I'm Shekhar
In
Suman, and
India
I wish to
and
congratulate all the Six
the
Sigma
Middle East,
certified.
and lots of videos we have. But
On 21st of May
forward
2019,
and American Society of Quality, Saudi Railways, American Railways, Indian Railways. It's an honor. Lots of, I keep writing articles in newspapers in Hindi, English, Times of India, Gulf News about process improvement. Deputy Health Minister of Saudi Arabia, Dr. Tarif Alama, along with his whole team, plus also
we have
Dr.
Dr. Tarif Alama with us,
They are
the
all
Deputy Minister.
students. And yes, So there are lots of benefits. Why do people go for Lean and Six Sigma? Because there are many benefits. Now, can you tell me what are the similarities here? A manufacturing company improves production by 30%. A hospital reduces discharge time of patients from 3 hours to 15 minutes. 64% reduction in recruitment time in a multinational company. Hotel improves customer experience and increases bookings to almost 2 times. A bank reduces errors and cycle times by 80% with enhanced CSAT, and insurance claims time reduced by 70%. Now, what is a common thread running through all of these points? If you can tell me that, and you can answer in the chat box, because you are muted, all of you are muted, and yes. So yes, so we have Mohammed talking about speed and managing criteria. Hansel is talking about processing time. Ruba is saying enhancing the performances, and great, improved efficiency. Nitish telling Francis about, yes. So all of you are right. All of you are right. All of you are right. They have all used Lean Six Sigma and data analysis to achieve breakthrough improvements. So many companies have done this, and we have helped lots of companies to achieve this. This is just a list. So what Lean and Six Sigma can do for you? It can reduce the cost, reduce the defects, reduce the waste, reduce the rework, reduce the cycle time, and improve the quality, production efficiency, productivity, customer satisfaction, capacity, profitability, and resilience. Now, which CEO would not love a person who can achieve all these things? So the green belts and black belts who are able to achieve all these things are loved by the CEOs and the senior management. I would be a little fast during the yellow belt. My speed will be a little fast, and I hope my speed is fine, because I would like to give you as many tools as possible in the 2-hour duration. And if you are willing to spend another half an hour, I strongly recommend. I will even tell you about the roadmap of implementing Lean and Six Sigma, and I'll show you some case studies also. Okay. Now, it all started in Motorola, and Bob Gelvin, the CEO, took up a challenge that he would like to improve everything by 5 times. And he invited suggestions. So Bill Smith and Michael Harry, they gave some suggestions saying that why don't we apply statistical tools, quality tools, to improve our processes and use project approach. So he liked that idea. And he asked Bill Smith and Michael Harry, how many projects you have completed? So they say that, well, we have completed around 2 projects in the last 2 years. So he said, I want hundreds of projects to be completed in the organization, and devise a methodology. And they designed Lean and Six Sigma. They said, we will train the people in statistical tools and techniques, and they will do the projects. And that's how green bills and black bills were born. Motorola won the first Malcolm Baldrige Award, which is the highest quality award in US. And in his award acceptance speech, Mr. Bob Gelvin, he said that this is all happened because of Lean and Six Sigma. So whole world was listening, and Jack Welch of GE was also very much impressed with this methodology, and he told all his employees that if you are not a green belt, you will not be promoted. So everyone wanted to be a green belt. They started doing lots of projects, and that's how Lean Six Sigma again became very popular in GE. Then they started telling their suppliers that if you want to win a business from us, you have to implement Lean and Six Sigma. So their supplier said, well, what is that, Lean Six Sigma? So GE said, well, our master black belts will come and teach you and train you and help you implement Lean Six Sigma. So this is how Lean Six Sigma spread all around the world. And today, most of the Fortune 100 companies and Fortune 500 companies, they have implemented Six Sigma. Okay, so let us understand what is very, very basic understanding of Six Sigma. Now, I see a lot of people from healthcare also. So today, I will start with the healthcare example for some time. Maybe when I'm explaining Lean, maybe I'll try to use healthcare example. And when I'm explaining Six Sigma, then I'll try to take an example from a manufacturing industry. And then after that, that will be around 15 minutes. After that, I will start doing a project. Now, this project which I would be doing will be a common thing. Common means from a process which has even you have healthcare also, or even manufacturing, or any company has recruitment. So we will reduce the recruitment cycle time in our company. So we'll do a project. So if you ask me, what is lean in 3 sentences? So my answer would be that lean is map the process, identify the waste in the system, and reduce the waste so that you are able to reduce the cycle time, and you are able to reduce the errors by implementing 5S and Pokayoke. I'll explain. Pokayoke means mistake proofing. Even by mistake, you should not be able to commit a mistake. It's a methodology. Like, for example, you must have seen, you cannot put your SIM card in your mobile phone in the wrong way, because there is a cut or a slight cut on the corner. So it prevents you from putting the SIM card in the wrong way in your mobile. So even by mistake, you cannot commit a mistake. So something like that. So lean is about mapping the process, identifying the waste in the system. Now, waste in the system doesn't mean that the waste we generate in our, or we throw in the dustbin. That's not the waste. We are talking about the process waste. So all of our processes, all of our organizations, they have waste. Now, this waste, which is invisible to naked eye, is hidden in our processes. So in order to identify them, if you learn about these 7 or 8 kinds of waste, it will help you to detect and reduce them. One of the waste is waiting. So we are waiting. I'm waiting for you to complete the job, and it's a waste of time. Transportation, which the customer is not willing to pay for, it's a waste. Say, for example, if I tell you that I'm coming to conduct a training program, and I'm first taking a flight and then taking a taxi, etc., etc., and what you are interested is only the value. Value. What is the value here? Value here from this training program, if you're my customers. So a customer is always interested in the value. So first you identify the value, what the customer is interested in, and after that, evaluate each and every step which you are executing, to see whether every step is adding value or not. If it is adding value, means if the customer is willing to pay for it, and it is also done right the first time, that is also important, because if you are doing rework, it's not a value added activity, because you committed a mistake and you are doing it again. So you wasted the resources. So it's also a non-value added activity. In fact, anything starting with rework, revise, relook, it is known as waste. So every activity you evaluate, and based on that, you will identify the waste in the system. So transportation, if the customer is not willing to pay for, is a waste. Like, for example, if I tell you to deliver this training, I had traveled 2 to 3 continents. By the way, I keep traveling. Every time I join, every time, I am in a different continent every week. Next week, I'm traveling to Dubai. After that, I'll be in Riyadh. After that, I'll be in Kuwait, etc., etc. So a lot of clients we have in Oman. So I keep going around these places. Although I have a permanent residence in Australia, but very rarely I stayed in Australia. Okay, now, so we're talking about the waiting, transportation, over-processing. Over-processing means you are giving the customer something they are not willing to pay for. We're still giving. You think that customer will be happy, but actually customer doesn't value that. It is all wastes. Inventory, lot of money is hidden in the inventory in the organization. Raw material inventory, work in process inventory. Rework. As I said, anything starting with re is a waste. So you have rework, rejections, scrap. This is all waste. Underutilized resources. So if you are not using the intelligence of the people, in the organization. If we are not using the skills of the people in the organization, it's a huge waste. And overproduction, if you are producing more than required, it's a waste. So let us take some example. Now, because I see, although it was not a plan to give these detailed examples of lean, but let me ask you, would you like to know more about lean or some examples related to lean? If yes, then I will take some examples. Otherwise, I'll directly jump to. So Muhammad and Ivan is telling about yes. A lot of people are telling yes. Okay. So now let me talk about lean. And here I will take example from healthcare industry. Okay. So healthcare industry is something which is uh, uh, is implementing lean. Lots of organizations, lots of hospitals have implemented lean. So I'm just, I'll come back to our flow very soon. So this is all hidden waste: overcapacity, extra man hours, overtime, searching, waiting, transportation, walking, looking for files, paperwork, unnecessary paperwork. They are all examples of lean, wastes. So lean targets the waste. So you have to develop an eye to look for waste in your processes, in your organization. So waste of intelligence. To remember waste, there are many ways. You can just remember I swim to, intellect, scrap, waiting, inventory, or there is another acronym, Tim Woods. So you can choose anything, but the waste remain the same. So this is how, sometimes people also use this acronym, downtime. Okay. So these are one and the same. So identifying the waste, let me take some examples in your organization. So this, in one of the Chinese hospital, we conducted this exercise. And in fact, I did the same exercise in King Saud University also, King Fahd Medical City also, many hospitals I have done this. And this all have done for Aramco also, ADNOC also. So all, this Ferrari world also. So let's take a simple process. Now, what is the value? First, I identify the value. The value is that I want to know the status of my health. As a patient, I want to know the status of my health. The patient here is the customer. So what is the value add from the customer's perspective? I want to know my health status. Now, for that, if you are telling me to walk to the OPD, register in OPD, it is all non-value added activities. I'm not willing to pay for it. Now you will say, well, it is required. No, it is required by you, by the hospital, but it is not adding any value to me as a patient. So these are all non-value added activities: walking to the lab, waiting for phlebotomist, drawing blood, maybe, yeah, because that's required. And maybe, so there are only two value-added activities: blood test processing and drawing the blood. Remaining are non-value-added activities. So you have to be a little harsh in identifying the non-value-added activities, and you will be surprised to know, once you develop an eye for waste, once you look for waste, when you are able to detect the waste in your system, 80% or 90%, sometimes 95% of your time is spent in non-value added activities. So you need to remove. So this is a huge, there's a huge opportunity of reducing the waste in your organization. One of the simple examples I'll give: waste of intelligence. Now, nurses are there to give medicine, dispense the medicine, take care of the patient. Now, if the patients, 80%, one survey found 80% of nurse calls from inpatients were housekeeping in nature. Means, my bed sheet is dirty, my pillow cover is dirty. What is happening? You are wasting intelligence of nurse in an activity which you should not be utilizing. Nurse will forget to give you the medicine. One more thing, that you are in fact underutilizing the nurse. Some more examples I'll give. When you apply lean, identify the waste in the system, you could, and in fact, these are all our case studies. They are all published in journals. They're published in sometimes newspapers also, and also in many of the TV shows in Australia, in Gulf News, in Gulf, and in India. We have shared these case studies. Double cardiology lab capacity from 8 to 16. Work was redesigned without adding any staff or buying new technology. In a single day, the capacity was doubled to accommodate 16 exams from 8 to 16. We could reduce the diagnosis to exam time from 2,700 minutes to 64 minutes. So patients had to wait up to 6 days between the cardiologist exam conducted in the doctor's office and the treadmill exam conducted in the diagnostics lab. After observing the flow of patients from the cardiologist's office to the diagnostic lab, two physicians decided to see the patients in the diagnostic lab. Patients make now appointments to see the cardiologist there. The daily schedule for diagnostic exams was changed so that patients could get both exams done on the same day. So the flow of the process was changed to suit the patients, not to suit the schedules of the physicians. So when you start thinking about the customers, you drastically improve the process. And also, they also reduce loss of waste in the system. Now, these are simple things, but we are ignorant of it because no one has analyzed that process. The process which you are following today was designed 10 years ago, 15 years ago, maybe 20 years ago. And no one has relooked at the process from new perspective. Technology has changed, environment has changed, lots of equipments have changed, but still you are following a process designed 10 years ago or 15 years ago. So in that case, try to have a relook, identify the wastes. There's a technique called escape technique. First, you map the process and or for all steps, ask question, can I eliminate? ESCAP, can I eliminate? Let me tell you, let me write it down. Escape, can I eliminate? Can I simplify? Can I combine the two steps? Can I automate or can I make it parallel? In the green belt, we do an exercise also. In our training program, we do an exercise together from various industries, and we share a lot of case studies also from various industries. Similarly, there are many case studies. I'll move on. Waste to be reduced and also value to be created. Unnecessary process or motion, unnecessary waiting, unnecessary transportation, unnecessary stocks, errors, etc. Underutilized person, underutilized equipment. On a funny note, like cost of a 5-minute MD walk is $6. Walk to the elevator for a nurse is 1 minute. Elevator wait is 3 minutes. Elevator travel is 1 minute. Walk to lab or pharmacy is 1 minute. Nurse cost per hour in US is $50. Cost of one trip, $5. Now, we did this for a US hospital, and cost of 5 trips per day per nurse, $25. And cost of elevator wait per day per nurse is $12.50. And you can imagine, multiplied by 365 days, multiplied by 200 nurses working in the large hospital, it runs into millions of dollars. Just elevator wait. And just imagine, so much of waste is there in our system. Lab and pharmacy on second floor, radiation on ground floor. Why not have both of them on same floor? So that you can reduce the waste of walking and motion. Interruptions during the exam room on a phone call, it's a waste. There is an example. I was talking about mistake proofing, also known as poka-yoke. In Japanese, poka-yoke means mistake proofing, or sometimes they also call it as idiot proofing, even a fool proofing. Even a foolish person cannot commit a mistake. Like, for example, we'll never burn the rice in a rice cooker because automatically it switches off. Similarly, we can prevent wrong surgeries and lots of defects, errors by following poka-yoke. You can have smart machines which cannot be set nor operated beyond the normal safe or maximum levels. You can have smart heparin infusion pumps which will not go beyond the desired level. Errors can be reduced by putting abnormal values that cannot be entered. So these are all examples which you can always follow and apply which is also coming under the POCA UK. Oxygen and nitrogen cylinders cannot be interchanged because they are having different connections. So POCA UK, we have put in some video links for you, and I will also put one link for ESCAP. So these are, and if you want to learn more about all these techniques, you can always watch these videos. I'm giving you lots of videos for free. So please go ahead and watch these videos. We'll be also sending you the links in the email, but better to copy these links right away and store it somewhere. And when you are moving around in the mobile, you can always watch these videos. In very simple way, very simple examples we have taught you. Hospital, other POCA examples is fixed number of packages during the surgery so that you don't forget anything. Complete catheter kits for insertion and pre-packaged medication cart with correct doses. These are all POCA UK techniques. Well, so now let us go back. So I just thought, now let us go back to Six Sigma. So I was talking about lean. Lean, once again, 3 sentences. Map the process as is. As is means the way it is done today. And how it is mapped? By doing Gemba. Gemba means go to the field, go to the place of action. That is known as Gemba investigation. In Japanese, Gemba means go to the battleground, go to the place of action. So here, don't sit on a table and imagine how the things are taking place, but go to the area where the work is taking place and see for yourself what is happening. And then map the process, then identify the waste, and you will get a lot of waste in your system. Now that was lean, reducing the waste by mapping the process and reducing the cycle times and reducing the errors. Now what about Six Sigma? Six Sigma also does the same thing. It reduces the cycle times, reduces the errors, defects. And one of the important things it does is reducing the variation. Variation means, let us say you go to I'll give a simple example. Let us say a car manufacturing company is selling some cars. They have a showroom and you want to buy one of their cars, one of the models you have chosen. And you go to the car showroom and the showroom manager says, well, I've got 5 cars available with me, exactly what the of that model which you want. And you can pick up, and let's say you are looking for black color. So these are 5 black color cars. Now you can pick up anything, any car, isn't it? Because you trust that there is no variation in the 5 cars. You can pick up any car and you're sure of that quality. But if the showroom manager says that was first car, the brakes are a little bit better, the second car headlights are a little bit better, and the third car maybe I'm just taking a simple example, the engine is a little bit better. You would not like such a company. You would not like this variation. Or let's say, talk about McDonald's. You go to McDonald's, anywhere you go, in whichever city, Riyadh, Dammam, Jeddah, Dubai, or London, wherever, the quality of service, the product, etc., it is almost the same. Even the colors, the brand. You are paying for the trust because the organization, the product is a result of process orientation. It is not people dependent. Process orientation, not people dependent. That is why any process which talks about process dependency or system dependency is reliable. Because people come and go out of the system, but processes, if they are well in place, then they will deliver consistent quality without any variation. Another example could be, if I take some example here, let's say you are producing chocolates. And in chocolates, if you are, let's say, you wanted, let's say your specification is that, in fact, we are doing this project in Riyadh. Next week, I'm coming to Riyadh to do this project for a bakery. But anyway, so weight is 100 plus minus 3 grams. Okay, let's say that is the specification of the chocolate weight. Lower specification limit set by the customer is 97 grams. And upper specification limit is 103, means I'm promising my customers 100 plus minus 3 grams. These are known as specification limits. Specification limits are always set by the customer. But process has got its own voice. See, what the customer wants, we call it as voice of customer. I can explain this. So some of you might be totally new to this concept. So let me explain this a little bit. Okay. So this is known as lower specification limit. This is upper specification limit. Now let's say there are three organizations, three companies. First company, when you collect the chocolates from this particular company, let me write down, lower specification limit is 97 grams. Upper specification limit is 100 grams. And the specification set by the customer is 100 plus minus 3 grams. So this will be 103 grams. 97. Now my machine can produce in various ways. Now if I collect the data from the machine, now whenever I collect the data from a repetitive process means anything which is being repeated again and again. That is known as repetitive process. So if I collect the data from a repetitive process, it will always follow a distribution which is known as a normal distribution. We call it as normal distribution, which is normal to obtain a normal distribution. Say, for example, process may follow some distribution like this. Most of my chocolates are at 100 grams, but sometimes they go up to some chocolates go beyond 103. And sometimes they go below 97. Do you think the customer is happy? Do you think customers are happy? Just write yes or no. Because you are going beyond, your management is unhappy, and here you are going below, your customers are getting less chocolates. This is known as defects. Defects, errors. This is known as defects or errors. We are making mistakes. We can predict the mistakes, errors, by drawing the distribution curve, probability distribution curve. So I can say probably I'm producing, here it is 10%, here 10%. I'm producing 20% defects. 20% defects. 20% errors. 20 in 100. In 1 million, it is 200,000. We call it as DPMO, defects per million opportunities. DPMO, defects per million opportunities. So in 1 million chocolates, 200,000 are too much, 20%. Now there is another company, another machine. Another company, another machine. Let's call it green company. Most of the chocolates are 100. Most of the chocolates are 100. And now tell me, never you are going beyond 100 and let's say 1. Never you are going below 99. Now tell me, are you making any error or defect? Are you making any? No. And is there any probability of making, of course, see, this normal distribution never touches the x-axis. It goes on and on. There is a probability, but 0.000, maybe 15 here, 0.00015. If you combine together 0.000034, okay, very, very less. Very, very less. Almost 3 defects in 1 million. If you go on adding 1 million, in 1 million, it is just 3 defects, around 3.4 we define. This is a Six Sigma process. So if you are interested in knowing Sigma also, I'll teach you. Although in the yellow belt, generally we don't touch upon all these things, but if you are interested, I'll teach you, no problems. But I have to remember that I'll be teaching you the DMAC approach also. So are you interested in learning the Sigma standard deviation also a little bit? Okay, fine. We'll talk. I'll talk about it. I'll talk about it. Just give me a moment. Then let me first, cover this part. So in a way, if you reduce the variation, if you are reducing the variation, you are going to reduce the defects in your organization. Now, this is applicable everywhere. I just gave an example of chocolate. This could be applicable to a surgery. Surgery needs to be performed between 45 minutes to, let's say, 65 minutes. In that case, there are specification limits. So every process has got specification limit. In the insurance company, the claims should be processed within 6 days. That is the specification limit. It could be a one-sided specification limit. Every company, every process has got a normal distribution. You have to just collect 30 samples, just 30 samples, and you will reveal the whole process. The 30 samples will give you the normal distribution, and you can understand about the whole process. Sometimes you will say 30 sample, how is it possible? Well, it is possible. In my training example, in my green belt and black belt sessions, multiple times, and every time, in fact, I say, let us predict about the heights of people in the whole world, of millions of people, by taking 30 samples. Usually my batch size is restricted to 30. So sometimes we get less people also, but it depends on, but generally we don't go beyond 30. Beyond 30, we generally put the person in the next batch. We run lots of batches continuously. We run on every Fridays also, Saturdays also, Sundays also. These are known as weekend batches. In the evenings, we run 2 hours batch. So you can choose any batch. In the morning, you can join 2 hours, or in the evenings, you can join 2 hours, or you can join a weekend batch. For Saudi Arabia, we have a Friday and Saturday batch. For other countries, we have got Saturday and Sunday batch. Whatever batch you want, you can join. Now, when you join our session, I take 30 samples, heights of 30 people, calculate the average and calculate the standard deviation. And based on that, we predict heights of millions of people. How to do that, I will come back to that in a short while, because you asked for it. I'll describe. But before that, let me also tell you. See, we conduct training programs, yellow belt, green belt, black belt, master belt. Let's understand a little bit about what exactly we do. So yellow belt means very, very basic understanding of what is Lean and Six Sigma. You can't do a project after yellow belt. You just know, okay, I know what is Lean and Six Sigma, etc. But a green belt can do a project. He knows application. He or she knows the application of the tools and techniques, and he or she can make a positive difference to their organization. The black belts, they know more tools and techniques, more statistically oriented tools and techniques, hypothesis test, ANOVA, design of experiments, chi-square test, etc. And they can contribute more. They can do cross-functional projects. They can do cross-boundary projects, multiple complex projects. And they can make meaningful calculations and also make a huge difference to the organization. Typically, green belt takes 3 months to complete a project. Black belt takes 6 months to complete the project. But when you join our sessions, which run usually for 1 to 2 months, then we do the project with you. So we do a project. We take data from a real project, and we do the project on the screen. And you also, today also I will do, but I will quickly do. I'll not do it. I'll just quickly show you the flow. In fact, some of the things I will try to do if time permits, but I'll show you how it is done. But when you are joining a green belt and black belt, you actually do. So you get the hands-on experience so that you are confident. And once you are confident, after that, you can even become a master black belt. So we are one of the few companies in the world which conducts yellow belt, green belt, black belt, and master black belt also. By the way, we also conduct PMP training, project management training. That training also I am conducting. Then we have AI, artificial intelligence, machine learning. That also partly I conduct. The statistical analysis part I do. Then we have Power BI training, which we have another trainers. And also in Lean Six Sigma, also we have got lots of trainers. We have so many trainers. Like, I have trained in the Middle East, means thousands of people, and many of them are very well-known trainers in Saudi Arabia. So a lot of people, a lot of my ex-students. So we train a master black belts also. It means master black belts can conduct training programs. Then if you want to get associated with us, you can conduct your training programs and we'll offer the certification support also. And you can go for green plus black plus master black belts right away at one go. We'll be giving you the link after a while. Once we, towards the end of the session, I'll give you the link, how to register, etc. So Mark is asking, is PMP is suitable for healthcare professional? PMP is definitely suitable for everyone because it is about project management. So you will be able to do better projects. But Lean and Six Sigma is much more, definitely very much applicable immediately to healthcare. You are talking about the process improvement. We also conduct CPHQ training, by the way, for healthcare professionals. So CPHQ training contains some of the tools and techniques which usually which we train in Lean and Six Sigma too. So highly recommended if you are interested in CPHQ, PMP, or Lean and Six Sigma, join us. Okay, now let us go to the DMAC. Let us start talking about DMAC, define, measure, analyze, improve, and control. So first, let us start with the define phase. So whenever you want to improve something, in an organization, you have to have a system mindset. You have to develop a systems mindset. Okay. And then, so let me tell you, some, instead of using jargons, I'm going to make a model of every organization in the world. This is applicable to all organizations. Think of your own organization and you will find that, oh, my organization also fits here. Your organization has a series of process steps which are taking place in departments A, B, C, D. And it is producing an output. Output is either a product or a service. There is no third kind of output. Product means if I'm producing a chocolate, it's a product. If I'm in the hospital, then it's a service. I'm treating a patient. Treatment is the service. Yeah. So output. And the output is consumed by a customer. I'm sure you are able to visualize your organization now. You have an output, which is a product or a service. Through a series of steps which are consuming, they are taking inputs. They are being processed. So if you are in manufacturing, you have raw materials, etc., people, equipment, etc. These are the inputs passing through the series of steps and producing the output. If you are in healthcare, inputs are the patient information, the patient himself, the physicians, nurses, the systems, the software you use, applications, equipment, and they are utilized through a series of steps like registration, then OPD or triage, etc. And then finally, you get an output, which is the treatment, which also is consumed by the customer. I'll not take more examples. I can go on and on for various domains. Lean and Six Sigma, all the tools are applicable to all domains. They are not domain specific. They are not domain specific. The thing which I'm doing right now is systems map, also known as value stream map. I'll tell you why. But let me first tell you about this whole systems map. So the customer is going to give you the feedback. The customer is going to tell you about the output. Well, I like you. Well, your times are different. I want you to be a little faster, etc. Because feedback will be received by the strategy team, planning team, the CEO's office, or scheduling team. Yeah. And they will inform the suppliers that please give us these raw materials, the inputs. And the planning team, depending on the feedback received from the customer about your service or the product, the planning team will inform the departments. They may change the procedures, policies, standard operating procedures so that departments A, B, C, D, the process steps A, B, C, D are able to deliver a better product or the service. This is how every organization in the world operates. This is known as systems thinking. Systems map, more popular is value stream map, VSM. Value stream map, how the value is created in my organization. Value stream map, given by Dr. Deming. It is initiated by Dr. Deming. This is how every organization works. Now, if there is a flow, constant flow of services, constant flow of from suppliers to inputs to A, B, C, D, and output and customers, then feedback. If there is a constant flow in the system, my system is healthy, then there is no interruption. But if there is an interruption, there are bottlenecks. B is fast, C is slow. What will happen? There would be a queue, work in process inventory. We call it inventory. There's a bottleneck there. It is restricting the flow. That is a waste, waiting time, inventory. You can identify improvement opportunities from in this way also. And I will be using in the define phase, we'll be using one tool called SIP. Here it is process, right? This is process. So SIP O and C, SIPOC, SIPOC. So we'll be doing a SIPOC in the define phase. So I have a systems approach. And one more thing, let me tell you, if I have told you so many things, so one more thing. See, how will I know the customer is happy? See, customer is not interested in the product. Customer is interested in the value which he or she gets from the product. See, like if I go to the hospital, I'm not interested in the medicine. I'm not interested in that prescription or that treatment. I'm interested in improving my health. That is the value. That is the value. Please understand. First, identify the value. When I'm, let's say, I'm buying a car. Customer is buying a car. Customer is not interested in the product or the car. Customer is interested in the value which he or she is deriving from the car, like transportation or speed or sometimes prestige. If you are buying Ferrari, then it's prestige along with speed. You have to identify the value, and the value is created through a stream of steps, value stream map. That is why it is known as value stream map, how I'm creating value for the customers. Now, value is an abstract thought, abstract, very difficult to define value. Value, I understand value, I know, but okay, I want better health, it's a value, but how can I express? And you can't improve if you cannot measure. So what happens is, you put some measures on the output. You will put some measures on the output. Now, these measures, some of the common measures of your product or service or output, very common measures, I'm sure most of you know. The three common measures: the cycle time of delivering that product or service, or cycle time of any process step also. Errors or mistakes or defects, if you are talking about manufacturing, errors in service, and the cost. So these are three important measures. We call these in Six Sigma as CTQ, critical to quality measure. So cycle time, errors, mistakes, defects, cost. These are three things, always, every product. Think about your product, think about your service. Definitely you are measuring these three for sure. Along with that, there could be many very product specific, like if I'm manufacturing chocolate, one could be weight of the chocolate. That could be a measure. If I'm talking about hospital, then it could be mortality rate, could be one of the measure. Or infection rate could be another measure. So measures, this is how I measure. And every measure has got a specification limit. Specification limit. Like, for example, cycle time should be less than 12 hours. Waiting time should be less than 30 minutes. Errors should be less than 5 errors per day, 2 errors per day, or it should be less than 1%. It could be measured. Or cost should be less than $10 per piece or per service. Or weight should be between 100 plus minus 3 grams. Weight, remember the weight also, I can put weight also, weight of the chocolate, 100 plus minus 3 grams, and so on and so forth. Please understand the system. If you understand the system, you can be easily you can become a consultant. Do we make you a consultant? See, I give you an organization and you can think of improvement, and I'll tell you the whole methodology in 2 hours. I'm just telling you, see, what this our secret, I've been consulting for now a total 33 years experience. Those who joined later, 33 experience, and 25 years I've been conducting these training programs. That is why I'm able to do it fast. And that's why I'm able to do it a little more in 2 hours. Otherwise, people take yellow belt, they take 1 day. Slowly and slowly, they'll tell you all unnecessary stories. They'll start telling about when I joined this. I did also this in the beginning, such to build up some confidence in you. But now it is to the point, lean, waste eliminated from the training program. Okay. So now this is a system. Now we have to understand specification limits plus the CTQ plus the measure. We call it as, it has a name, which I am sure many of you are familiar, KPI. Key performance indices, like weight, cost, error, mistake, and with a specification limit together becomes a KPI, my performance index. I'm going to measure my performance based on this, coming from the voice of customers. So I collect the voice of customer, understand what the customer wants, and convert this to KPI. I hope my speed is not fast. Please, I'm checking on my cycle time. I'm checking right now. You are my customer. I have to check one of the measures. I hope my speed is okay, or you want me to be slow a little bit? Let me know. Just say okay. If it's okay, then I can continue. Okay, fine. So, some people, one of you are telling, slow down a little bit. Okay, no problem. So I'll reduce the speed by 20%. No issues. No issues. Now, having understood this, now we are ready to do a project. Now, how you choose the projects? So a system is given to me. It could be a hospital, it could be a airline industry, it could be a railway company, it could be a National Healthcare Service or Ministry of Health or whatever. Everything is a system. I first look at the system, make a value stream map, how the value is created, and then identify what the customers are valuing. How do I measure cycle time, which is having a problem? Okay, my cycle times are not less than 12 hours. They are equal to 15 hours on an average. Errors or mistakes are not less than 5. There are 15 errors. Cost is not less than 10 hours. There are $15. Weight is not within plus 10 plus minus 3. It is actually 106 grams plus minus 2 grams. Totally off the mark. Then I will choose projects. I will start doing projects. Improvement projects. There are a lot of opportunities for improvement. There are lots of opportunities for improvement. So when you are looking at improvement opportunity, an improvement area, then in that case, you are thinking about project. So I want to reduce cycle time from 15 hours to 10 hours. And I would like to do it in the next 3 months. That means it's a project. So you choose a project, and this project is given to green belts and black belts, and black belts and green belts are taught the tools and techniques. And let us have a look at how it is done. So this company has given us a project. Imagine this company, and this is a real project which I did long time ago. We'll be learning as we do a DMAC project. We'll be learning about define SIPOC and project charter, measure types of data, normal distribution, control charts, analyze phase, cause and effect, Pareto, box plots, scatter plots, process mapping, in brainstorming, 5S, etc. Now, these are the tools which we are going to take you through, and let us choose the projects. So there's a company which wants to reduce the recruitment cycle time. Now, we have done many projects for this company, but I'm choosing recruitment cycle time because everyone understands recruitment. So it won't be a big struggle for you to understand the process. Your focus will be on learning the tools and techniques. So I'm choosing a simple process. Now, when you are trying to improve something, it's a measure. Recruitment cycle time. This measure is on the output. Now you understand, right? What I want to reduce? Recruitment cycle time. It's a measure on an output of a process. Which process I am talking about? I am talking about recruitment process. So my first focus will be on recruitment process. Let us start define, measure, analyze, improve, and control. In the define phase, of course, we form a team that a person who is the head of the department, we call him champion or the sponsor. The person who owns the process, the manager of that process, is known as process owner. Now, process owner means the person who knows the process, process owner. I'm sorry, I'm not able to see the comments for the time being, so I'll just give me 5 minutes. I'll just continue. So here, but you can write up to here you are with me. Just write down, say yes. So you form a team. You have a master black belt. You have team. You have you identify the green belts who are doing the project, and the manager of the process is the process owner. Now we have formed a team. And projects are always done in teams. First, we do a SIPOC. First, we understand the process. Not only the process steps, but also the outputs, inputs, and the suppliers. So once I understand the system, then only I will be able to improve my recruitment time. Measure on the output is known as Y, which is the recruitment time here. Now, I am telling you one model. Now, you can apply this model to your process. There would be a measure. You would be like cycle time, waiting time, errors, defects, infection rates, production rate, anything. It could be anything, any measure on your output. It will have a step, number 1, number 2, number 3, number 4, and it will have an input like IT system, job description, CV, budget, etc., HR staff, etc., and the suppliers. Yeah, so let me see your comments as well. Okay, yes. Okay, fine. So I hope, yeah, so thanks for telling me that, yes, you are with me till now. Now I'll complicate. Now you told me that you'd like to learn standard deviation. So in a short while, I'm going to introduce you to some statistical concepts also. It's good to see that you are interested in learning, because sometimes, we keep this training very simple basic tools, techniques, so that people say, yeah, I have understood everything, but we'll be complicating. See, Lean Six Sigma is very simple, but people find it complicated. But it yields excellent results. It is a data-oriented concept. It's a system-oriented, data-oriented concept. So you will see now, you'll see how and why it is important and why these tools and techniques really work. So now I'll write a project. I will write one more thing before we proceed. I told you that the measure on the output is known as the Y, which we call it a CTQ, critical to quality characteristic. And I also told you that there are three rules. The rule number 1 is you cannot improve if you cannot measure. Rule number 2 is everything can be measured. Rule number 3 is if you think something cannot be measured, go back to rule number 2. That means everything can be measured. Let me tell you how everything can be measured. So there are 2 types of data. So don't be afraid of data, because when we talk about data, people are, well, we do not collect the data. But I don't want to give you the data because you are afraid that someone else will take the data, analyze it, and reveal your inefficiencies. Yeah. Or sometimes they say, I have too much of data, but I don't know what to do with it. Or sometimes they say analysis is too complicated. So all the excuses are lost and gone. You have Minitab today. When you join my green belt, black belt sessions, we train you in Minitab. We give you the Minitab software also. And we do the analysis together, which some of this I'll be showing you today. So first, let us understand, you can't improve if you cannot measure, and you can measure everything. How? Big? I can tell you a trick to measure everything. There are 2 types of data, continuous data and attribute data. Sometimes we feel that if something is not continuous data, that means it is not measurable. Like we know height, weight, blood pressure, everything we can measure. We say, yeah, it is measurable. But what about happiness? What about emotions? Well, difficult to measure. Well, you can measure. Here is the trick. So first basic understanding, any data which can have a unit, this is a unit, days, kg, and there is a possibility of a decimal point. And now I'll go slow, which can be represented on a number line. Number line, remember that in maths teacher used to tell us in school, it's a number line. From minus infinity to plus infinity, any number can be represented on that number line. 55.5 days, Incidentally, that is my age also. 55.5 years. My age is a continuous data. Yeah. Height. These are all continuous data, and 30 to 50 samples are good enough to reveal everything about the whole population. Attribute data is categorical in nature. 200 to 1000 samples are required to reveal everything about the whole population. Yeah. Let me take some examples. By the way, I have got videos also, which talks about all these things. These are all available on my YouTube channel, just to reveal, just to show you what I mean. So I did talk about certain things. Now let me just give you a demo. Like if I...
Hi, I'm Amitabh Saxena, and thanks for process improvement. Means you select projects. Now, what is the definition of a project? Project has a starting point and an end point. Size 18, we'll see how to. What does Lean and Six Sigma bring it for you? Lean and Six Sigma reduces the costs, reduces the defects, wastes, rework, scatter plots, and regression. Have a decimal place. It can also. So we have to measure difficult. So focus. Means all the tools in tech, anything. There are two types of data: continuous data and attribute data. Continuous data can be represented on a number line. It can have a decimal place. It can also have a unit.
You can get access to all these videos on my YouTube channel. Just click Anexas. Go to YouTube channel. You can do it right away. Go to Anexas and just subscribe to the channel, and you'll get all the links to the videos, the whole program separately. This recording also you will get. This is the live program, but separately, all the things, taking an example, etc., on a nice whiteboard, has been also explained. So if you want to have a look at that, also revise in a different way, definitely you can do that. The video link, we will be giving a lot of videos, links also. They are all present in the Anexas Europe channel. Just subscribe and it becomes free for you. Subscribe means subscription is also free. Okay.
Say, for example, age, height. Age is 52.5 years. That's my age.
That was my age 3 years ago, by the way.
Hi, I'm Amitabh.
So I was just wanting
and finally, in chapter 26,
talk about that. Anyway, now let me take you through the types of data and some examples. And all the videos, when you join my green belt and black belt videos, all the videos you get access in the learning management system in detail, where I explained very, very complicated tools and techniques in a very easily understandable manner, which now also I'm going to do. There are two types of data: continuous data. So continuous data here is recruitment cycle time. Okay. And attribute data could be, so when you want to measure something which you think cannot be measured, so there is a trick to it. What is the trick? Write that attribute, whatever you want to measure. Let's say happiness you want to measure. Then create categories. Category. Now, easiest way, even there is a trick also, there also. If you can't think of category, easiest category, that binary category, presence or absence of that attribute, whatever you are interested in. Here you are interested in happiness. Write happy or unhappy. Then you write the count. So I checked with my 100 employees in the organization. Total 60 were happy, 40 were unhappy. So what happens? I can calculate the proportion. The next thing could be proportion. So whenever I am dealing with attribute data, I calculate the proportion. When I'm dealing with continuous data, I calculate average. 50 days is my recruitment time. On an average, 30 samples on an average. Proportion, around 100, 200 samples. Proportion is total one. One means portion out of one is proportion. If the circle is 1, 0.6 belongs to happiness, and 0.4 belongs to unhappy. So out of 1, what portion, that is proportion, is to category A, and what proportion goes to category B. Then I write that down. That is how we measure in statistics the categorical or attribute data. Now, 60 means 60.1% is not possible. 60 is a discrete count. That is why it's also known as discrete number. Discrete number. And now the human population is somehow habitual to look at percentage. Means, out of 100, they want to convert everything into 100. So if the circle was 100, this will be 60 and this will be 40. So this becomes 60%, this becomes 40%. Now, there is a possibility of making 60.1%, but that doesn't make this data as continuous data. Please remember, decimal point itself doesn't make this data continuous. There's no unit. So please remember this. When you are dealing with attribute data, some examples, errors, mistakes, defects. Now you'll say, well, it is continuous data. No. I'll tell you why. Let us say there are 2 employees. Let's say take an example of hospital. 2 nurses. A commits 10 mistakes per week. B commits 20 mistakes per week. Who is better nurse? Who is better employee? Most of the people will say A. Errors, right? Mistakes. Most of them will say, well, A is better, committing less mistakes. But please remember, mistakes is a count, is attribute data. And as soon as you know it's attribute data, you'll say, hey, tell me, what about the other category? No mistakes. Now, if I give you this number, A completed 100 jobs, A dealt with 100 patients, committed 10 mistakes. B dealt with 200 patients, committed 20 mistakes. Now, who's better? Both are same in terms of mistakes. If A was given 200 patients, she would have committed 20. If B was given 100 patients, he would have committed 10. So what is the better measure? Proportion. We'll commit this mistake if you are thinking mistake is a continuous data. Okay, remember that. Now, having understood this, and I'm assuming, have you understood, by the way, have you understood the continuous and attribute data types of data? Please write yes. Please write yes. So I'm okay. I'm still with you. I have not lost you. Some people just, oh, this is not my cup of tea. He's complicating. He's confusing. Okay, that's great. That's great. Now, be ready. Be ready. You asked for it, right? When I am collecting continuous data, how will I express? I will make histogram. Histogram. So recruitment cycle time is 50 days and goes as high as some number, and as just 30, 40 sample will tell you enough information. Attributed, I cannot make a histogram. I will make a bar chart. Happy or this is happy, unhappy, or a pie chart. Happy and happy. And there could be 5 category also: very happy, happy, neutral, unhappy, extremely unhappy, and then there will be 5 bar charts. Their pie chart, there'll be 5 portions. So I'm not just going into that detail. I hope you have understood. As long as you have understood, basic understanding is required right now. Now, Mr. Carl Friedrich Gauss, he studied this curve for 10, 15 years in 17th and 18th century. Okay. And he found one interesting phenomenon. What was that? Every repetitive process in the world, I'm talking about every repetitive process in the world, it follows normal distribution, like heights of people in the world, it follows normal distribution. Salaries of the people who are attending the program follows normal distribution. Age of the people who are attending this program follows normal distribution. Like, for example, most of you are, I'm just making assumption. Most of you are, let's say, 35 years on an average. Some are 40, some are 45. Very few there are above 50 like me. But there may be very few, some 30, 25, very few, almost none below 20, almost none above 50. None doesn't mean that never it will happen. It may happen, but very rarely. So most of the people are between 20 to 50 years. Now, I did not collect the data. I should have collected the data and made my conclusion, but I'm just giving an example. If I had collected the data, my average age was 35, and then how would I estimate this 20 and 30, 50? There's a trick to that also. This trick is coming from, again, Mr. Carl Friedrich Gauss. Mr. Gauss gave us a theorem. He gave us a theorem. This theorem was that everything follows normal distribution, and this normal distribution looks like a bell-shaped curve. Looks like a bell-shaped curve. This is a probability distribution, never touches the x-axis. It goes on and on till infinity, and on till infinity. Yes. But interesting thing is, every repetitive process has got average, plus every repetitive process has got standard deviation. Now, if you are interested in knowing how to calculate standard deviation, if you are interested in knowing how to derive the formula for standard deviation, that video also I have made. So you can watch that video later on, because those who are interested going into deeper into this, you can always watch. So I'll put that video link here. But for the time being, please understand, it's very easy to calculate a standard deviation, average or standard deviation, very easy. It's not difficult. So let us say my average is 50 and standard deviation is 5 days in my recruitment process. So Mr. Gauss found, and this is a phenomenon, this is a theorem. Theorem is like it is found. You don't have to prove it. He found that every time, for every process, and I'm talking about every process, not one process, he found that plus 3 times and minus 3 times within that range, will have 99.73% of the data. Now, this is an interesting finding. Now, why it happens, it is, we can say we don't know, but it happens. Yeah, it's an interesting information. Why not use it? Yeah. So if I take an example, let us say, if I just convert this, 50 minutes is my traveling time from my home to office. Okay. So I'm taking 50 minutes. One standard deviation will be how much? 55. 2 standard deviation will be how much? 60. And 3 standard deviation will be how much? 65. And minus 1 standard deviation will be how much? 45. I hope you are with me till now. I hope you are with me till now. Yeah. So 35 and 65 are known as control limits. Control limits. We call it as LCL and UCL. Control limits. Voice of process. They are different from voice of customers. So remember, there was a voice of customer. Voice of customer is this. LSL and USL, lower specification limit, upper specification limit. But what is voice of process? Voice of process is LCL and UCL. So LCL and UCL should be within the specification limits. Okay. Then we are not producing any errors or mistakes. If it is above or below, we are producing mistakes or errors. So I hope you have understood what is control limit and what is specification limit. I hope you have understood. I'm repeating. Control limit is plus minus 3 times standard deviation. So I can easily make my control limits. And I can make a control chart. LCL is here in my case 35. If I'm talking about my traveling time, 35 minutes. UCL is 65 minutes. I hope my calculations are correct. Sometimes, I'm too excited and I do my simple calculations incorrectly. And then the people say he can't even add or subtract also. Correct. I hope this is correct, right? 35, 6. I hope you understood how I got it. Now, this could be a recruitment cycle time also. And you'll always find my traveling time or cycle time or whatever, production, waiting time for patients, time taken to take surgery. This concept is applicable everywhere. My sales, my production in tons, 35 tons to 65 tons, that's my control limits. This is how my sales are. Now, if I keep worrying about, oh, my sale has increased today and it has gone down next day, it is waste of my time and the company's time. Green belt, black belt will always look at the control limits. This is how my process is. And he would be, if it's the sales, he would be interested in changing the control limits to new control limits. That is a real improvement. And if it is waiting time, then you are interested in lowering the control limits. This is statistical thinking. But what is non-statistical thinking? The way we manage our operations. Let me tell you how we manage. Let's say this is errors, number of errors per day. Here we got lowest errors. Oh, here we got lowest. Wow, team, did a great job. Next week it becomes more. Here I gave, best, lowest errors in the last 6 months. Or if it is sales, it could be, oh, highest sales in the last 6 months. Happy, very happy. Next time it goes up, the errors go up. Yeah. Then I start telling, oh, what happened? We start finding reasons. What went wrong? This went wrong, that went. Then it goes up further. Oh, now this team really needs some tough love. I really need to get an emergency meeting, get some expert to talk about errors, etc. And he talks about errors. Some nice lecture is given to it reduces. We see, oh, that lecture worked. This is how we managed our day-to-day operation. A green belt or black belt relaxes. He says, you do whatever you want to do. Given this process, given this type of training, the way you operate equipment, you are going to be between this. This is known as common cause variation. All the causes, like this is like say, this variation is due to lots of causes. If I make a cause and effect diagram, this is known as fishbone diagram. Whatever I am trying to improve, we write in the box. Why? It's my improvement. I want to increase my sales. There could be many factors, advertisement, skills, season, this and that, lots of factors. Collectively, all these factors are acting on my process, producing this variation. Yeah. I hope I'm giving multiple examples in the same diagram. It is not confusing you. Sometimes I'm talking about sales. Sometimes I'm talking about waiting time of a patient in the hospital. Sometimes I'm talking about the production. The tool remains the same. I'm trying to tell you that tool is neutral to the domain. That is the purpose. I'm not trying to confuse you. I hope you are with me still. Have you understood the concept of common causes? Just write yes or no. I can slow down the speed. I can slow down the speed. Don't worry. Don't worry. I can slow down the speed. So I see unbelievable. It's yes. Oh, sometimes one person is saying 50-50. Okay, but everyone is telling yes. Let me revise. By the way, if you want to, uh, you know, I have taken some day-to-day life examples also, very slowly, in a relaxed manner. These videos are also available. You can always watch my control chart, basics of control chart video, which my team member will put here in the chat box. So you can repeat. You can. I have taken very simple example. Now, let us continue. We were doing a project, remember? So we have learned a lot of concept. Now our journey will be very easy. So we are in the define phase. And the define phase, the last thing which we do is write a project charter. We write a project charter. Okay. So now what we have done in the define phase, we have done, first we have formed a team. We have formed a team, then write a SIPOC, and also understood the voice of customer, converted into measure. And then one of the measure we choose, and which is one measure I'm choosing? I'm choosing recruitment cycle time. So today my recruitment cycle time is 50 days, and I would like to reduce it 30 days by July 2011. By the way, this project was done in July 2011. Yeah. Presented 13 years now. I had a little bit more hairs on my head those days. Approximately, if I'm able to do, I'm going to save $300,000 for the company. Okay. So these are the three major areas as a project charter, as a yellow belt, you should know. Then we move on to the measure phase. Now I have talked a lot about measure data, so you can understand this very easily. Why is the symptom that something is wrong? Means cycle time is high, errors, complaints. These are symptoms of in a process that something is wrong. But the causes are the X factors. We call them X factors. Yeah. Yeah, some people are asking, can I get the certificate? Yes, you will be getting the certificate. You have to attend the full program. Then you can get the certificate. Yes. You'll be getting the certificate. Yes. So Y and X. It's like, when I go to the doctor and I tell him I'm having fever. So first he will measure. He can't improve, he cannot measure. So here degree Celsius or degree Fahrenheit is the measure. But he will not treat the fever. He will not treat the symptom. He will first identify the root cause, collect the data, identify the root cause, and treat. That's what we do in the Six Sigma. We just don't focus on the recruitment time. We get to the root cause by collecting the data. So when we have, so I've already talked about basic statistics. I quickly jump. And the way we do, let me show you. First, we collect the data, and let's say this is the actual data which we had collected. So 15 samples are shown here. And this is mini tab. I'll demonstrate. I'll just tell you, don't worry how I'm doing, because when you join my black belt session, green belt session, you will learn all these things. Stat, basic statistics, and graphical summary. And if I just click on this, I want to know about recruitment cycle time, it will tell me, it will give me the histogram, it will give me the average is 50, standard deviation is 4.7, which is almost 5. Yeah. Then after that, I can also ask to make control chart. What is the lower control limit and upper control limit? I can predict also from here, but why to predict? But everything is so handy, easily done. I can ask Minitab to make. I can ask Minitab to make. Control charts. So you can say that in my organization, it takes 36 days to 64 days to recruit the people. And this is a natural variation of my process. Yeah, this is how I'm performing. There's another, I will not emphasize too much on it, but there's one more tool. So you make a histogram, you plot the histogram, control charts, and also you can also identify how many defects are there. So here, first you have to define a defect. What is a defect? Here, any recruitment taking more than 60 days is a defect. So how many defects are there? 27 defects in 47. Okay. So how many defects per million opportunities? In 1 million, I will be having 627,000, which is around 62% of the recruitments are delayed. So in this case, my sigma level, I'll go to one table. It is again based on the normal distribution, but I'll not go into that detail right now because I want to show you the whole project, how it is done, rather than explaining each and every tool and technique. You can always join my sessions for understanding understanding the details of these tools and techniques. But for the time being, we associate it with a sigma level. 6 sigma means you are just making 3 defects in 1 million opportunities. You are at right now 1.14 sigma. You move on to the analyze phase. In the analyze phase, you can take 2 routes. One is known as the lean route. Lean route means map the process, do a Gemba walk, identify the waste in the system. Or you can use a data door where you can make a cause and effect diagram. Or you can make a control impact matrix or a Pareto chart or a box plots and scatter plots. We'll learn all these things very briefly. Cause and effect diagram is something. So first, let us start with the process map. So process road, lean road. So first, I'll expand my process map in 50, 30, 70, whatever is the number of steps by doing a Gemba investigation. And identify where is the waste. Maybe this is wasteful step. This is a wasteful step. I can do escape analysis. Eliminate. I will ask 5 questions on each step. Can I eliminate it? Can I simplify it? Can I combine it with other steps? Can I automate it? Or can I make it in parallel with other steps? Okay. Some of that I can do. So I will get some good solutions. And within 2 hours of escape analysis, I can come out with a new process. Okay, this was lean rotia or process door. Let's talk about the data door. Data door would be, I will invite everyone to a meeting and I'll ask, can you think of all the possible causes which are responsible for high recruitment time? And people start giving ideas. To channelize their thinking, I can use 6M techniques, which we call it 6Ms. Means I'll tell them, think about different categories. Mankind means people-related reasons, machine-related reasons, material-related reasons, measurement-related reasons, environment-related reasons, and method-related reasons. Man, machine, material, measurement, environment, methods. Try to get a cause and effect diagram. Try to get a cause and effect diagram, and here I can always do a cause and effect diagram, also known as Pareto analysis, also known as Ishikawa diagram. So man, machine, material, methods, environment, machines. Now, I have got all the causes, but not every cause is responsible for my problem. Vilfredo Pareto was an Italian economist who found that 80% of the problem was with 20% of, actually, he found 80% of the money in Italy was with 20% of the people. So 80% of the people had 20% of the wealth, and 20% of the people had 80% of the wealth. He called it an 80-20 rule. And Joseph Juran, he applied this to quality, and he said, 80% of the problem, whatever you are trying to solve, is due to 20% of the causes only. So what you do, you collect the data. You can do voting also, or you can collect the data also. So here they have done voting. Which causes are appearing most of the time? It could be the real data also, or it could be the voting also. And arrange them in descending order, highest on the top and lowest in the bottom, in the descending order. And then we look at the Pareto, cause and effect diagram, and Pareto. You will find when we arrange, and it's very easy to do Pareto in Minitab. I'm just demonstrating. I don't expect you to make it right now because I'm just telling you. So we collected the data here, which causes are occurring. So some of the causes are occurring again and again. Some of the causes, let's say JD not available, job description or not available, assessment time is too long. These are all reasons. So Minitab can count all these reasons for you. And very easily it can create those. It will say, well, assessment time is appearing most of the time in your reasons. Job description is not available is also one of the root causes. Approval time is contributed. So, and the percentage contribution also is given here out of the total causes. So assessment time is contributing 34%. JD not available is Minitab. Moaz is asking what is Minitab. Minitab is a software you can download from minitab.com. And when you join our sessions, but that is a trial version which will expire in 30 days. Yeah, but we'll be giving you the full version. So when you join our session. So, Minitab is a software. I hope, Moaz, I have answered your question. So here, assessment time is contributing 34%. Job description is 23%. Approval time is 15%. And 10%. And if you see the cumulative is total. First two are contributing 34 plus 23, this is 57%. First three are contributing 73, and first four are contributing almost 84%. So let me focus on this 84%. These four causes. And I'll get my root causes. You can further analyze. See, you can further validate these root causes like recruitment time and approval time. Now we suspect that approval time is affecting my recruitment time. Is it? We can do when the data are both continuous and continuous data. I can use scatter plot. What I can do is scatter plot, recruitment time and approval time. And if there is a relationship between the two, like if it appears the approval time is affecting the recruitment time, then in that case, yes, You will say approval time needs to be reduced, and you'll cut down some of the approval steps and improve the approval process. This is going to definitely reduce your recruitment time. That is the root cause. But let us look at recruitment time and assessment time. Assessing the job description, resume of the employees, prospective employees. Is it affecting? Well, let me see. So again, I'll try to plot. Now I'm doing it a little fast because I would like to, wanted to show you lots of tools in shortest time. But I will request you, if you can wait for half an hour additional, I'll tell you the roadmap of Lean Six Sigma also, which is also interesting, by the way. But now let me show you the analysis part. So here, there is no relationship. So I would say I will be wasting my time if I work on assessment time. It's not going to help. Okay. So this is how I'm doing. This is how I'm doing the analysis part. So the purpose of this was to just demonstrate, not to teach you this last 5-10 minutes. I just wanted to show you some analysis. There are lots of analytical tools and techniques, more than 15, 20, which we learn. Data analysis, and based on that, you can make conclusions. But now, let us go back to our project. So now I have got my root causes. I know that these two are top two or 30% are contributing. By the way, I conduct live training, and in my normal green belt training, I am very slow because I want you to do also with me. Okay. Recordings are available for lifetime. 2 projects are done in the class, and project guidance is provided for lifetime. Whenever you want to do real project, I'll be there to help you. You can also earn money out of these projects. So you'll be with me. People who are attended my programs 25 years ago, still they are with me. They know me. One of the CEOs, one of the students now becomes CEO of very largest retail company in Saudi Arabia. There are a lot of companies in Saudi Arabia. I've trained their ground level workers to the CEOs. Naqil, Uthaim, National Business Company. These are all, for the last 20, 25 years, I have been conducting the trainings. I'm inviting you to join my trainings. Before I proceed to the improve phase, let me invite you to join my trainings. The link is given here, and the trainings is done. My team, I'll just take a brief pause here, and then I'll continue with the improve phase. Improve phase is very easy. Control phase is also easy. So I'll take a pause here, and my team, if you can share the dates. So my team will share the dates. Those who are interested, they can join my sessions. And I'll be happy to interact with you. If I'm in Riyadh, I'll be happy to meet you. Jeddah, Dammam, I keep traveling. Dubai, Abu Dhabi. Next week, I'm in Abu Dhabi, by the way. I'm in Ferrari World. They are our clients. I'm in Warner Brothers. So here, let's say, so here we are talking about trainings on Saturdays or Sundays or Fridays, Saturdays. The dates are given here. Please join my training. I'm inviting you. You can choose either of the 4 options. And also, these are the different rates. But if you are registering today, you will get a very good discount. Very, very good discount. So it's only for today and tomorrow, till tomorrow. If you register, you'll get a great discounted rate. It is just for, actually, we have extended the new year offer, which was actually till January only, but we have extended it for some time, only for this batch, because we are supposed to conduct this training in January, but anyway, it got delayed by 2-3 days. So we are still extending this offer. It will not be there afterwards. And you can do Master Black Belt also. You can do a Power BI also. You can do a mix, jumbo, lots of trainings, lots of certificates. You'll get yellow belt, green belt, black belt, master black belt, Power BI in a package. So please, register if you are interested. Those who are interested. Okay, let me ask you one thing. So if you are interested, can you please do a poll, please? Whoever is interested, just if you can just let us know. So I will be in touch with you separately. If you are interested, I'll tell you about the links and lots of ways. So if you can just tell me about your decision, and based on that, I'll be getting in touch with you. Okay, so fine, that's great. And also see, if you join my sessions online, when I'm conducting a live session in any of your city, you are most welcome to join free of cost. So we'll tell you whenever I'm doing a session in your city, all our ex-students can join our session free of cost. Yeah, so good. So these are the days. And thanks for your response. A lot of people have responded. These are the timings. Those who are asking for the timings, please, if you can tell us the timings as well. Go back to the previous slide. So these are the timings, Saturdays, Sundays, etc. Okay, thank you. So now we can close the poll. Okay. Okay, these are the upcoming free webinars. If you want your friends or you also want to attend, these are some of the. Yes, so we are going to send the certificate for the today's training. And let me just finish with the improve phase. So let's go back. That was a pause which we had taken. So in the improve phase, you generate the ideas based on the root causes. And once you generate the ideas based on the root causes, then there are different techniques, like 6 people write 3 ideas in 5 minutes, generate 108 ideas. If you are interested in learning 65 techniques, the link is also given to you. So various techniques, if you use, you can also do FMEA, failure modes and effects analysis. If you are interested in learning about FMEA, I'll give you the link as well. FMEA is a technique where you imagine how you will fail and you take preventive action, so that you don't fail. So that is FMEA. So you generate lots of ideas using techniques, which you are going to learn in our green belt and black belt sessions. And once you choose the solutions on the root causes, you implement those solutions, and that's what this organization did. And once they implemented, they put some control systems in place. Control systems in place in the sense that when you improve your process, here they have reduced the recruitment time. It should remain like that forever. It should not go back to original number later on after 6-7 months. So that is why you control the gains, hold the gains. And this is how you can do a DMAC. So that was, typical DMAC project. And the best graph with the CEO is looking at, he is looking to see, is before and after. What was the before and what was the after? So if I just look at that, this diagram shows, I mean that, lower and upper control limit earlier was different and now it is different. So my process has improved, and there is statistically significant improvement. So this we have done in many companies. Now, what I'll do, I'll just show, I'll just take a 2-minute break. And in 2 minutes break, I'll just leave you with a video, which is talking about, let's say, And I'll tell you then after that, I'll tell you about the roadmap, how Lean Six Sigma is implemented. It's very, very interesting. So just stay on for some time. It's very, very interesting. But let me just show you some of the reactions of our people. And I'll just take a 2-minute break. And after that, we will start.
Reached out to our operations. So I reached out to our operations team and we headed straight here to Formula Rossa, one of the signature rides here at Ferrari World at Abu Dhabi, and we decided to work on how we could increase the reliability of the time it takes to update our queue time boards, because as you know, every minute that guest waits in a queue line is super important.
We had the brainstorming session with the team and we went through a few topics and then we chose the most appropriate one for the course. The chosen topic was reduce facilities management service request closeout time.
So I was eager to use statistics and data analytics to solve a business challenge. One of the challenges we had is the erosion of the retail per capita spend in Ferrari World Abu Dhabi, and that was my topic.
Well, actually, being an HR professional, recruitment lead time has been always a problem across the board. So taking that subject in specific will help me improve onto the recruitment cycle.
So what we had worked on was redesigning the product launch process, which we've now implemented.
We had a discussion within our team and the most critical area that we faced was our closing process. So we decided among ourselves that this is the one that we should go for.
Yeah, the course that we did was a week-long online facilitated course. It was fantastic. It showed us the whole methodology behind Lean Six Sigma, and it also provided a various amount of tools that we could be able to use to improve all of the existing processes that we have here in the park.
Well, it was 1 week training. It was very interesting and always energetic in terms of interaction in the class. Every single day has been different and the knowledge sharing has been remarkable.
This gave us a broader perspective to understand the issues, and it gave us opportunity to do some brainstorming, and we were able to come up with better solutions from a wholesome perspective.
It was a very stimulating experience where we met every day with the colleagues, all very engaged, eager to learn and keen on and willing to actually pause, step back from their day-to-day work to get some new perspectives. So it was really a refreshing exercise.
When an issue comes to us, we try to think about it from a Lean Six Sigma perspective. We try to define the issue, we make a project charter about it, we try to analyze it. So it has changed the perspective of how we look at issues.
Statistics allowed me to understand the root cause of the problem and come up with the very targeted improvement initiatives that we aim at implementing within the year. So every dirham per cap increase would represent 1 million revenue uplifts in a standard year. So the impact can be significant.
Well, this program is in benefit not just for me as a recruiter, but it helps the whole organization in terms of how we can identify issues, how we can look into problems.
So what's really exciting is that since we completed the course and we implemented all of the changes that we worked through, we have 100% seen a decrease in the time that it takes to upload the queue time boards, which is really cool. And one other really exciting thing is that one of the recommendations that the team and I put forward through in our project, for the project I should say, is that has now been funded through the business. So you'll have to watch this space for more. I can't tell you just yet.
These are some of the reactions. Now let me take you through the roadmap. How Lean Six Sigma is implemented in the organization. Now, those who have chosen to stay back for half an hour, it's a very, very good learning, important learning, and I'll be talking about how the organizations they implement. So when the organization choose to implement the Lean and Six Sigma, they choose the projects from different departments, different businesses. They identify the improvement opportunities, and they convert this into projects. And they nominate the green belts. So we generally form a steering committee, which contains the quality leader and a master black belt like me. he or she trains, the senior management first, half a day to 1 day, what exactly Lean Six Sigma is. It can also include the senior management. We call them champions or sponsors. And then they nominate the black belts and green belts. Once they understand the basics of Six Sigma in the champions training, then they nominate the green belts and black belts to do the projects, and then they are allocated the projects, what areas you need to improve. So first is champions training. Like, for example, here I am conducting a champions training for a Swiss company. The senior management is being trained. We use a business game there. I gave them a problem to solve, and after that, max basic approaches, and then they actually solved the problem. And then they got convinced that this approach really works. Then we identify the projects, and then after that, we conduct the green belt or the black belt training. And then we execute the project, we guide them. So now, okay, so if I go back to where we were, champions training, the senior managements are changed. Now they nominate the green belts and black belts. So now they are in the room.
Team name 1, 2, 3.
So now what they are doing, they've come together to learn the tools and techniques, and they are starting the training. So in the training also, the way I was telling in online, I do the project. In the classroom also, I do the project. If you are interested or your organization is interested in getting me in your organization for conducting the training or running the projects, I'll be happy to do so. And in fact, I keep looking for opportunities. So please let me know, or let your organization get in touch with me. I'll be happy to do a physical 2-hour training for you, totally free of cost. And after that, if you are interested, we can also take you through the green belt and black belt training programs. So feel free to get in touch with us. Now, so let me talk a little.
And Team Builder, and your slogan 1, 2, 3. Green air, go! Okay. And your song. 1, 2, 3. Here it goes.
Let's go green! Let's go green! Let's go green! We are the champions! We are the team!
Wow!
So now they have got.
Your team name 1, 2, 3. Your slogan 1, 2, 3.
So anyway, so once they have learned, then they execute the project. And look at this person, black belt from National Healthcare Service, UK, who has completed the project. He's presented the project. Now I'm telling him to talk about it for you guys. In short.
Well, we have Alex with us, and he has done excellent Lean and Six Sigma projects in National Healthcare Service and in hospitals. So, Alex, would you like to tell us something about it?
Hello, I'm Alex Wells, Head of Service Improvements at the Royal Liverpool University Hospital. I've been really fortunate to present today on how us as a trust are using Lean and Six Sigma principles to deliver better care for our patients. I've presented today on a lot of the work that we've done around how we've improved patient outcomes, reducing mortality, improving length of stay, and also talked about how we can actually realise some financial benefits from that. Over the past 2 years, we've been really fortunate that we've done some good work, and it's actually delivered us £2 million worth of quality efficiencies through delivering better patient care.
The Bang Muscat also, we have got video credentials. Let me show you this last one video. And after that, I'll continue. So here, Nakil is one of the logistics companies.
My name is Mohammed Al-Bayati. I'm the CEO of Naql. Through Anexas, Mr. Amitabh has taught me and more than 1,000 employees of Naql, Six Sigma and Lean processes. This affected our bottom lines by millions of riyals, and it is having a big impact in changing our company from a local company to a regional or multinational company. thanks to Anexas and Mr. Amitabh. Thank you very much.
So companies also do get transformed using Lean and Six Sigma. So, well, this was all about, general things, if you have any questions, this is how, Lean and Six Sigma is implemented. So when you join my sessions, usually you will be doing the project, you will become a green belt, an event black belt, and master black belt also we conduct, and you can become a trainer also, or you can become a consultant. So you can choose to be on your own, independent consultant once you become a master black belt. So I'd like to invite you once again to attend my training programs. I'm looking forward to you. I'll just maybe some videos, if my team wants to play, I'll be happy to answer your questions as you watch these videos. If anyone wants to arrange for their company, just let us know, let me know, let our team know. I'll be happy to conduct the session for you and run some projects for you also. We have got a strong team also, project consultants, who will be happy to do projects in your organization. And our success rate is very, very good. The success rate is very, very good. Our projects really are successful always. And we make you successful also. Okay, please, team, you can, my team can you put some, let's say, Lean Six Sigma 10 minutes at, say, 2 minutes, etc. Yeah, please go ahead, please.
Confused about Lean and Six Sigma? Here is everything you need to know. Let me start with the training objectives. The first one is to educate you in Lean Six Sigma. Our main objective is to provide you with the right education. When you give your hard-earned money to anyone for anything, your priority must be to get the best results out of it. I understand that, and in fact, everyone here at Anexas believes in that, and this is why we keep quality of training as our highest priority. Second one is to enable you to improve processes. When you think about Lean Six Sigma, process improvement should be the first thing that should come to your mind. Identification of risks, errors, defects in a process and removing them is what LSS aims to do. The third one is to make you a star performer. To elaborate a little bit more, being a Lean Six Sigma Green and Black Belt will signify that you are capable of helping your organization reduce risk and eliminate errors and defects. You can improve business processes and sustain quality improvement since LSS is flexible in every domain. Your worth will increase in every industry. You would gain hands-on experience in quality management and much, much more. Now, let me tell you if Lean Six Sigma can be a good career. If I go on to explain how good a career Lean Six Sigma can be, then you will have to listen to me for the next 2 hours. But let me keep it short and explain the career opportunities in LSS. You can be a process improvement manager, Lean Six Sigma consultant, more efficient, operations manager, quality director, chief quality officer, healthcare quality specialist, lean manufacturing engineer, process development engineer, compliance structural engineer, reliability engineer, operating system specialist, senior IT project manager, data scientist, project engineer, director, performance excellence, etc., etc., etc. Now, let me tell you how we provide the training. The first one is learn from home. All our trainings are conducted online currently, so you can sit at your home comfortably and get trained to become a professional green or black belt. I have an experience of 30 years in this field and I can proudly say that I am the best person you can learn LSS from. Next is, certificates provided by Anexas are valid internationally. But during the training, we focus on learning the concepts, tools and techniques and everything that the course has to offer. I believe that certificates can be provided from anywhere, but gaining knowledge and the right guidance cannot be provided by everyone. And the third point is, all courses provided by Anexas are practical. We do not simply explain the concepts on paper and move on. We teach you how to implement those techniques in projects and in real life. So, if anyone asks you whether you know how to use these techniques in real life, you can proudly say yes. We offer weekday and weekend trainings. Everything is at your convenience. So all you have to do is to set your mind on your target and leave all your worries to us. So what are you waiting for? Join me in Lean Six Sigma training and let us work together to give you the best future you deserve.
Okay, so how some people are asking, so do you want uh, 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 do you want, oh yeah, please go ahead, yes. Do you want any specific domain? Just let us know. We'll be happy to show you the applications, telecommunications, or banking or healthcare. We'll be happy to tell you about the applications. Yes, please go ahead.
Lean and Six Sigma is an improvement methodology which reduces costs, defects, errors, cycle times, and increases the customer satisfaction, resulting in better efficiency and higher profits. In short, it does whatever a CEO or a shareholders want. It is used in all domains, be it manufacturing, services, oil and gas, IT, construction, banking, healthcare, textile, telecom, BPO, and whatnot. Here, we convert the improvement opportunities in the organizations to projects and train people like you who are working in these processes as green belts and black belts who execute those projects in 5 phases: define, measure, analyze, improve, and control. In define phase, we set the direction for improvement by writing a problem and goal statement and forming a project team. In measure, we collect the data and understand how the process is performing. In analyze, we analyze the root causes. We map the process, identify the waste, use cause and effect diagram, Pareto analysis, graphical analysis, and hypothesis tests. In improve phase, we generate ideas to take care of root causes using lots of tools like brainstorming, mistake proofing, FMEA, etc. And in control phase, we sustain the improvements for a long time by using process management and control charts. To become a black belt, you just need to know addition, subtraction, multiplication, division, and of course, a lot of fire in the belly. Do I need to tell you that? Of course, it is Anexas where professionalism meets fun and where people fall in love with statistics and process improvement. Well, that's what our clients tell us. And we take pride in telling that we are the best. If you are not doing Six Sigma with us, then you are missing something.
Okay, let us look at the healthcare. That's also okay. Lean construction is also okay. Let's go ahead.
There are so many stakeholders in construction industry: the customer and the users of your building or construction, the project organization, the contractors, and the staff at the construction site. Lean has something for everyone. Of course, our primary objective is to satisfy the customers, both external and internal, so you can reduce the project delays and quality defects in your organization. You can improve the safety of the employees at the construction site, reduce the inspection times and non-compliances, drastically cut down on the rework resulting from errors. We have even reduced the architectural designing time in many cases to almost 50% of the original time by eliminating the wastes in the process. Once a process has been perfected with the lean methods, there are safeguards as well as checks and balances put into place to ensure that this efficiency continues through the life of a building or structure that has been constructed. In this particular industry, errors mean danger and extremely costly rework using expensive raw materials. So taking the time to eliminate errors before they happen is crucial to the success of any company specializing in constructing any type of building or dwelling. If a construction company is looking to minimize defects, then Lean course can really help the bottom line and make a huge difference. You can even combine it with Six Sigma and make it Lean and Six Sigma implementation to take the advantage of statistical tools also. The employees take up improvement projects after getting trained as green belts and black belts. They focus on identifying and eliminating any unnecessary waste in that particular system. This is one aspect of lean certification methodology that creates great demand for certified professionals, especially true in the construction industry. A specialized lean certification in construction will give the employees the tools they need to improve the quality of whatever they are building. Lean is a skill set that all of the leading construction companies in the world know to invest in when it comes to hire their employees. Because this eliminates the errors and also improves the quality, customers start to take notice and become loyal to the brand, knowing that they will always be able to get the best possible building at the lowest possible prices. Companies who utilize lean methods know the importance of quality, and the quality of their employees are at the top of the list. Certified employees are a resource that construction companies are willing to invest in. This is why salaries of certified individuals are on an average significantly more than the non-certified colleagues. This also improves the overall corporate culture within a construction company. Because of the certified individuals, everyone knows their role and expectations within the company and exactly how teams need to work together to bring about the positive changes. Do share this video with your friends in construction industry and let me know on what topic I should make my next video.
Anexas Master Black Belt Amitabh Saxena, and let me talk about importance of Lean and Six Sigma in healthcare. Lean Six Sigma concepts are used in industries all over the world to improve a process, eliminate waste, and reduce defects. In the healthcare industry, defects not only affect revenue and customer satisfaction, but they signify the difference between life and death. Lean Six Sigma is critically important in healthcare because it helps in reducing defects that can result in medical errors. There are so many challenges in the healthcare industry, like an aging population, shortage of workers, increasing litigation, and many more that require long-term improvement. Because healthcare industry deals with saving lives, errors cannot be accepted at any cost. So, how does Lean Six Sigma really help? With the help of Lean Six Sigma, you can shorten the waiting times in hospitals. The lesser the people wait, the efficient the hospitals will become. Reduce medication errors and even try to completely eliminate them. Improve turnaround time for lab results. Provide better care at lower costs. Ensure that the medical staff makes fewer errors, reduce mortality rates, improve patient care, improve quality, and improve overall patient experience. How can you do that? By training the staff as green belts and black belts and allowing them to do improvement projects. Lean Six Sigma training and certification in healthcare provides the tools needed to address the challenges at various levels. It is a time for the healthcare industry to utilize Lean Six Sigma methods to its fullest and drastically change the healthcare industry for the better. Don't you want to be a part of the industry where patients are happier, physicians want to work for you, the cost is as low as possible, and at the same time efficiency is high? If your answer is yes, then Lean Six Sigma is your choice. We have implemented Lean Six Sigma in more than 25 hospitals worldwide, including ministries of health of 4 countries, and we can help you too.
The world we have created is the product of our own thinking, and we cannot improve the world without improving our thinking. The long-term chronic problems of manufacturing companies like low productivity, lower machine efficiency, high rework, high inventories, high product wastage can't be solved using only experience, logic and intuition. You might be a good operations person, a good engineer or an excellent operator, but you need to have basic knowledge and understanding of some problem solving and process improvement tools too. Here is how Lean Six Sigma can improve your processes in manufacturing. Lean Six Sigma is defined as a business improvement method that aims to maximize the shareholders' value by improving the quality, speed, customer satisfaction, and reduce the costs. It merges tools and principles from both Lean and Six Sigma to do this. It has become the most popular business strategies for deploying continuous improvement in the manufacturing industries. With its help, you can make sure that only essential steps remain in a process. The moment I say Lean Six Sigma techniques, high quality, low cost, increased profits, and customer satisfaction should automatically come to your mind. It is very rightly said that machines are mere pieces of metal if they cannot be made efficient. Lean Six Sigma helps you to do this. What is the core of Lean Six Sigma? It's DMAC. Yes, define, measure, analyze, improve, and control. It helps you to reduce the existing problems with unknown causes. Here we train the staff of the manufacturing units as the green belts and black belts, and they convert all the problems into improvement projects. So now the difficulties become opportunities. Then they complete these projects and get certified. It's a win-win for both the organization and the employees. Now, how does Lean Six Sigma decrease the cost? Shijo Shingo said that the most hazardous waste is the waste that we do not recognize. Firstly, Lean Six Sigma focuses on removing the 7 wastes like overproduction, transportation, inventory, etc. from a process. In manufacturing sector, this step can lower the cost of a process by leaps and bounds. Secondly, Lean Six Sigma focuses on solving the problems caused by a process. Here we focus on the processes, not on people, because we believe that 85% of the problems are due to the processes and not due to the people. Defects in your product can cost your organization a fortune. So the focus is on reducing the defects by focusing on the processes. Let me talk about some Lean Six Sigma tools that can be used in manufacturing. Value stream mapping, Kanban, 5S, cause and effect analysis, control charts, DMAC, 5 Whys, Kaizen, hypothesis tests, etc., etc., etc. Let us talk about a few. 5S. A well-organized workplace becomes important if you want to eliminate waste and reduce the errors. 5S is the way to do that. Control charts. By understanding the control charts, you can understand the difference between the common causes and special causes. For special causes, you take immediate action, and for common causes, you take long-term actions. Kanban. It is a visualizing tool on maximizing the flow of goods and work without unnecessary inventory or transportation. Then we have 5 Whys. Ask why 5 times and you will get to the root cause of the problem. Hypothesis tests. They establish the relationship between the outputs and inputs, and you can get the root cause with 95% confidence. Value stream mapping. It is used for defining and assessing the movement of the raw materials from the beginning of the process to delivery to the customer. It is a way in which the current state of a process is documented and the future state is visualized. If you want in-depth knowledge about all the tools and techniques, you can always join my Lean Six Sigma Green Belt and Black Belt training programs. So that was about Lean Six Sigma in manufacturing. I hope you have got a clear picture about why Lean Six Sigma is so important in the manufacturing industry. Share this video with your friends and don't forget to subscribe to our channel if you don't want to miss out on our important updates on the tools and techniques of Lean and Six Sigma and even project management. Happy learning!
So thanks a lot. Thanks a lot for attending the session today.